guys, we're the founders of Myofascial Canada. My name is Nelin.
I'm Justin.
And we are the co-owners of Myofascial Canada and our physical location, Myofascial Release, Mississauga.
And so people often ask, how we got started, why myofascial release. My first exposure to myofascial release was actually as a student, and my final clinical placement was not one that I actually selected. It was selected for me, and it definitely wasn't what I had expected. I was asked to watch some materials and read some materials beforehand, and to put it simply, it was low production quality, really weird. There was a patient on the table writhing around and stretching in weird ways, while a gentleman with a beard and mustache looked very eccentric, with the mountains behind him, was just chatting as if nothing was happening. It was very strange, right? And at the time, I really didn't know what to expect, but my clinical instructor simply said, we're going to be observing, just watch and see what happens. And, time did this weird thing where before I knew it, things were happening on the table I wasn't expecting, and this client, this first one we saw, who had both rotator cuff repairs in their shoulders and a lot of pain and range of motion restriction, he was pivoting on his head with his hips in the air, and my clinical instructor was holding him by his feet with one hand while he was grunting and making all kinds of noise and sweating. And again, it was really, really weird, right? I had no idea what I was seeing, but it looked and felt very important. And by the time that the appointment had ended, he was thanking and profusely hugging, and he was sweating, and he was just very, very thankful, and his range of motion improved considerably as well. And I have no idea what happened, right? And I just confused, right? So other experiences similar to this, some unsimilar to this, but by the end of the week, I had seen profound changes in mobility and range of motion with what looked like very little effort and work on the therapist's part. And I just knew I had to understand and learn this approach so that I could help patients in this way too.
Yeah, and for me, I started working as a physiotherapist in the hospital setting. So I was doing acute care, working in surgery and ER, and I was starting to get pretty burned out. But just in practicing myofascial release and teaching me self-myofascial release techniques is really what got me through being able to do that job, because it was very physically demanding. And so after the birth of our first child, I was looking to make a change, and Justin had been working in a solo practice for a little while and was getting really busy. So we just decided it was time to jump in and open a practice together, and we both agreed that focusing on chronic pain and myofascial release was the way to go.
When we experience aches, pains, or trauma, our body adapts to those pressures and discomfort that we experience by altering how we hold ourselves in gravity. This creates areas of stickiness as the fluidity in that system changes to support those altered positions in space to keep you what your body believes to be safe. What myofascial release is looking for those hot, vibratory areas of stickiness and dysfunction and holding gentle pressure or stretch into those tissues and waiting for a melt in that fluidity to occur. That melt is basically that stickiness going back to its normal resting state. And as it does that, it reduces pressure on pain-sensitive structures. It allows for increased range of motion and improvement in motor coordination, while also at that 5-minute mark or longer, which is why the sustained pressure part is so important. It's that sustained 5-minute period or longer. The body actually releases its own anti-inflammatories and blood vessel opening chemicals that also continue to help longer term alleviating pain sensation that often is associated with the chronic discomfort that pressure creates in the body. So myofascial release in itself is a very holistic therapy because on a cellular level, every cell is embedded in and made up of this fascial tissue. So what we have is when you're addressing the fascia, you are addressing the nervous system, the endocrine system, the musculoskeletal system. The issue, though, is that manual hands-on therapy can only take you so far. At some point, the garbage in is going to equal the garbage out, which means that if you aren't paying attention to what you're eating, potentially even when you're eating it, your thoughts or feelings that are going into your mind or some of the emotional stressors that are affecting you, you're unable to really get from point A to point B just by manual therapy alone. You need a little bit of extra support, which is why we're able to work with our nutritionist, our psychologist on staff, and our traditional Chinese medicine acupuncturist to help push the boundaries of your awareness of what you're feeling in your system and get you a more thorough recovery from your symptoms and pain. No injury in your body occurs without there being some sort of emotional context, right? So when you hurt yourself, whether that's physical or even emotional, what ends up happening is we create these bracing and avoidance strategies. That combination of the lack of movement in areas that are achy, sore, or uncomfortable, or perception of fear moving or engaging in the world in certain ways creates this fascial restriction. It's that solidification of the ground substance that becomes that restriction tension. The issue is that the emotions can also be tied into that as well. And that experience, along with the physical tension in your body, become trapped and stuck. On its own, little tiny issues accruing over time might eventually create larger symptoms that we start to notice, things like irritable bowel syndrome, or even issues related to endocrine system and PCOS. They might become larger, like fibromyalgia or major issues with sleep, but it's when that straw that breaks the camel's back, that one extra little thing, whether it's a major incident or just that accrual over time of these little problems, eventually pushes you over into a state where you can't get out of that discomfort again, that we really start to see your symptoms just blow up. What myofascial release does is it creates an opportunity to feel into the system, and as the release occurs and things open and soften, to actually bring the capacity to consciously become aware of some of those emotions and those sensations and process them, deal with them. And by doing self-care regularly, you can actually prevent these larger problems from coming in and affecting you, because along the way you're working on the little things that create those larger problems in the first place.
A lot of our clients think that pain is a normal part of aging, and it's not. Truly, our bodies can function optimally and we can live pain-free into our old age, but people think that as we age, the body starts to break down and that process causes pain. But what's really happening is, for most people, is that as they age, the fascial restrictions that have accumulated over their lifetime from various traumas, both physical and emotional, have built up and accrued to a point where their body is just in pain more readily, more easily after activity, and sometimes just constantly. And the reason for that is because they haven't learned how to properly address those myofascial restrictions. We're all, told that we need to eat healthy and be active, and those things are important and great. But when it comes to pain, if you're not also addressing the restrictions that have been building up in your body, you're gonna feel some discomfort as you age, because they just accrue as we get older. A good example of this in terms of a misconception around aging and pain is arthritis. A lot of clients feel that arthritis is a lifelong diagnosis, something that can't be reversed, and they're just unlucky to have been diagnosed with it. And the truth is that arthritis really is just inflammation of the joint. Inflammation of any joint, really. And the thing causing the inflammation is various patterns of sprain and strain around that joint. And so those things are creating inflammation and also forcing the joint surfaces closer together. But if we remove that pattern of sprain and strain through myofascial release, then we alleviate the extra pressure on the joint and we reduce the inflammation. And typically when we remove inflammation, we also usually don't feel pain. So, we've had clients who have x-rays that show completely bone-on-bone arthritis, but they're actually asymptomatic because myofascial release has allowed that joint to function more optimally. A really quick little anecdote that we like to share with clients when trying to explain this to them is this little comic strip joke that we've seen before, that where an elderly patient comes in to see their doctor, they sit at the exam table and they say to their doctor, my left leg hurts. And their doctor says, oh, yeah, that's just a normal part of aging. And the client says, or sorry, the patient says, well, but my right leg's the same age and it doesn't hurt. So that's a good way to sort of think about the idea and the misconceptions around chronic pain and aging. Myofascial release challenges the idea that pain is a normal part of aging, in that myofascial release theory suggests that pain is a result of restrictions in the fascia. And you can do myofascial release, learn myofascial release, release those restrictions in your fascia at any age. So that piece is completely not age dependent. The other piece here is that wellness occurs in the same way. Literally at any age, you can improve your wellness to some extent. And so that's how we see the aging process. And we know many therapists and clients who are older in their years and have been living really healthy, vibrant, active lives with very little pain because they've learned the tools of myofascial release.
Because of the complexity of the myofascial system, every body is unique, and with 8 billion people in the world, that's 8 billion different potential fascial strain patterns based on your personal experience of the world around you, gravity, previous injuries, emotional stressors, etc. So what a trained MFR therapist does is we look for, where is the body hot, red, or vibratory? Where is it bracing or holding tension? And through a combination of that of the movement and glide in that system on physical assessment, how things are actually moving as we put pressure in there, as you pull and stretch, as well as a little bit of intuitive focus as to, where you're being directed by some of those movements. The therapist will pick an appropriate technique and hold. That can be in a stretch, it can be a compression, it can be a cross hand release, it might be a pulling of a limb, that sort of thing. Ultimately though, this holding at the barrier as the tissues melt will create sensations in the body, or it will create a physiological change in the tissue underneath the therapist's hands. So most commonly what you'll see is heat or redness. Sometimes a patient will even express feeling some sensation of pull or stretch or something being addressed elsewhere in the system beyond where the therapist's hands are actually placed. And this is the best evidence for where to go next. The body literally starts to guide you exactly what needs treatment, and even the order potentially, right? And every time you do this, it can potentially be different because we're different throughout the day, let alone between therapists or between patients. So what this means from a treatment perspective is even the most complex medical illnesses, as long as there's very, very few absolute contraindications to treatment, but as long as a trained therapist is approaching that body gently, never forcing the barrier, you will always be able to help create some sort of shift or change in that person's body and their experience of the world. For self-treatment, our clients are taught to do a body scan so that they can start to notice some of these sensations of pressure, heat, tension in their body on their own, and then apply some of the self-care techniques that we've given them using a treatment ball or some other tools. Sometimes it could just be laying down and stretching like you would in the morning. If you think about the way that you will sometimes elongate, sometimes compress, sometimes create tension as you're doing an early morning stretch. This is the language of the body as it's releasing tension, and it's learning to understand what it is the body's actually asking for and do that in order to support a natural self-corrective movement. As long as you never force or you never lead, our patients can use that body scan, tap into the system, and help create some of the same benefits that we help them get when we're treating them in person. This unwinding, which is what we call it, is one of the most natural self-corrective forces we have available to us. Every animal in the animal kingdom does this. You've probably seen your pet or even your young children writhe around and stretch in weird, funny ways. It is self-corrective in nature, and it's something that we forget how to do because of our training to sit still and pay attention in class, that sort of thing, right? So it's one of the greatest gifts that you can give to yourself is to learn and reconnect with what it feels like to engage with your system in that way. One of the biggest misconceptions from our clients, after having taken all this effort and time to try and figure out why they're feeling symptoms, is now they have this diagnosis and they believe it's a life sentence. this is my arthritis, this is my permanent insert diagnosis here. This is perpetuated not just by our expectations, because we knew a person who experienced this before, or things we read on the internet, or what the healthcare community at large is saying, or what your doctor is saying about your capacity to live a joy-filled and comfortable life with this diagnosis. Ultimately, the locus of control goes from something that you can actually do something about to, now I have this thing, now I'm stuck in it, it's my this, it's my that. Why would you ever want to identify with that? You're identifying with those symptoms and claiming them as your own, when what we should really be doing is identifying with how we would like to feel, right? You can have that diagnosis and still live a very comfortable life, right? So what we want to do is understand that in epigenetics, the study of how much what you're actually experiencing physically is related to your genetics, environment, it plays a huge role, except in very specific medical conditions that are very strongly genetically linked. Most of what we experience is actually determined by how we perceive our environment. The same genes will code for completely different proteins when your body is in distress versus in comfort and ease. The same stressful job, if you really love it, can suddenly become an incredible source of distress and dysfunction in your body if suddenly you start losing clients or losing money and things are going really poorly. So if you have the capacity to decide what you put into your body, whether that's food, whether those are thoughts, whether those are feelings or emotions, or who you engage with in your environment, you suddenly have a great deal of control over what you're doing. You can choose to do some light exercise. You can choose to engage in myofascial self-care. All these things contribute to your ability to heal yourself. Another key component for myofascial release specifically is when you're experiencing a restriction in your body, that tension, that pain, more often than not, the symptoms we're feeling are months, years after that initial injury. You're no longer experiencing a mechanical damage to the tissue anymore. What you're experiencing is a sensitized nervous system, and that your body, through the fascial system and that dehydration that created that restriction in the first place, is exerting up to 2,000 pounds per square inch of force on itself. It's crushing pressure on nerves, blood vessel, and muscle. It feels terrible, right? So what you're really doing when you engage in the barrier and wait for that melt is you're decreasing the pressure in the system and allowing the natural biochemical processes of healing to occur. If you take in all the best nutrition and all the best nutrients and supplements, they can't get to the target tissue if that target tissue is restricted and experiencing that gluing down of the extracellular space. So by releasing the tension through myofascial release and doing these other things, you're creating an optimal environment for your body to heal itself and to function normally. Myofascial release is without a doubt the future of healthcare. Our hospitals are overflowing, our family physicians are overwhelmed, and insurance companies don't cover enough paramedical or allied health private services to bridge that gap. Preventative or proactive healthcare remain buzzwords without much actual implementation. It costs money to run those kinds of programs, and no one knows where to start. In the fast-paced nature of our society, where we're trying to consume the next big quick fix, the thing that's going to make me better faster, make my symptoms go away, myofascial release forces us to slow down and use self-care that empowers individuals with the body awareness and strategies to address subtle shifts or imbalances in the body as they come up before they become serious issues requiring medical intervention. This really is preventative health care. Over the past 5 years since opening our clinic, we've been honored to receive yearly awards for excellence in practice and for our treating therapists individually for their contributions. We see significant accomplishment in surviving COVID, given that we opened our practice in January of 2020, while many of our colleagues, we observed them shutting down their clinics around us over the past few years. Our biggest accomplishment, though, is the pain relief and subsequent quality of life that's restored for our clients. Clients often find our office after months or even years of inadequate pain management, symptom resolution, or an inability to return to any sense of normalcy in their activities of daily living. And we've had the benefit of being able to help our patients resolve fibromyalgia, restless leg, TMJ dysfunction, tinnitus, and varying other conditions too long to list. But ultimately, it's been a wild ride, some of the people that we've met and the ways we've been able to help them over the last 5 years, and we look forward to continuing to do so. There's a fantastic story that you can read more about in the main article. If you'd like to read one such example of a patient that we worked with who was dealing with symptoms from a motor vehicle accident from 35 years prior.
Hi, I'm Justin.
And I'm Nelin, and we're the owners of Myofascial Release Mississauga.
Myofascial release is a safe, gentle, and effective hands-on technique to alleviate restricted fascia that can cause pressure on pain-sensitive structures of up to 2,000 pounds per square inch. These fascial restrictions caused by inflammation, trauma, and various other stressors respond best to gentle pressure applied over a prolonged period of time to create physiological changes to reduce inflammation, reduce pain, and improve mobility.
Using the sustained pressure myofascial release approach, our practitioners spend their time one-on-one with clients without the use of machines or a gym, typically for about an hour each session. Rather than just treating symptoms, our approach effectively engages the whole mind-body complex to alleviate the underlying imbalances responsible for the symptoms.
We have a special interest in chronic and complex pain conditions, but are well equipped to help people of all ages, from infants to centenarians, with a range of issues. We especially like working with people who feel like they haven't gotten complete resolution of their symptoms with other modalities and who are open to trying something new.
As our pace of life continues to speed up and the productivity demands of society increase, the burden on our physical and emotional health also increases. Recovery requires more than just a few strengthening exercises or a fancy tool or modality.
Our clinic offers physiotherapy, pelvic floor therapy, massage, manual osteopathy, traditional Chinese medicine, acupuncture, and myofascial yin yoga instruction. Our team has additional training in various areas such as pediatrics, osteoporosis management, Reiki, and hormone balance.
Our clients go through their treatment with a strong understanding of what they want, why it matters, and why myofascial techniques, in combination with physical and mental changes, will help them take steps closer to their goals. Since the techniques are not applied forcefully, the body is never injured, and individuals who are able to commit to themselves and to their journey see massive changes in their function, pain, and outlook.
Situated in the heart of Mississauga in the Greater Toronto Area, our aim is to create an environment for all people to heal from their trauma. Ultimately, our goal is to help all of our clients create a lifestyle that's greater than their pain.